लेडीज इसलिए कह रही हूँ क्योंकि लेडीज बातें कर रही हैं। आई एम सॉरी। थोड़ा आप लोग इधर तवज्जो दें। वी हैव विद अस डॉक्टर शाहिद। फर्स्ट ऑफ यू वेरी वेरी अप्रिशिएटिव कि आपने टाइम निकाला और हमारे साथ गिविंग इतना हमारे लिए इम्पोर्टेंट लेक्चर। और क्या बात करने वाले हैं डॉक्टर साहब, आई एम गोना लेट हिम टॉक अबाउट इट, बट वी जस्ट ग्रेटफुल कि हमारे साथ आए हैं एंड यू आर स्पेंडिंग दिस टाइम विद अस।
अस्सलाम वालेकुम। आवाज सबको ठीक है? Again, thank you, Brother Shakir,
Shazia,
to invite me for this thing. So, as I said, we'll talk about dementia. It's a huge topic, but I will try to summarize as much as I can in about 45 minutes or so, and then we'll have some questions. If anybody has some questions, I'll try to answer those. At the end, I will also share some references and stuff, and also a PDF of the presentation, which you can share and take home if you want to review what we talked about. As I was telling Brother Shakir, मेरी अंग्रेजी उर्दू ज़रा कमज़ोर है, तो most of my presentation will be in English.
मैं चाहता हूँ डॉक्टर मुसलमान डॉक्टर क्यों बोलते कमजोर है, उनको उर्दू आनी चाहिए।
When you ask seniors in this country, what is their number one concern? It's not worrying about dying. It's not worrying about running out of money. It's worrying about losing your memory, dementia. That is the number one concern. But on the other hand, remember that if we take appropriate interventions, if we do the things which I will mention, but soon enough, there's a significant probability that you can cut down the risk of getting dementia or the severity of the dementia. Sir, I will share the PDF so you don't have to take a picture. I'll share all the pictures. It'll be in a PDF format, so you can. So don't worry about it.
हम लोग प्रिंट करके भी दे देंगे आपको अगर
जी।
नहीं मैं वो बोर्ड पर देगा
And I will record everything.
हाँ ठीक है
I'm going the wrong way. Actually, the four things we'll talk about is what is dementia? Very simply, what is the brain structure and how it remembers the memories, because the main problem with dementia is losing the memory. So before we talk about losing the memory, we want to know how the brain kind of stores it. So very simply, I will tell you how it tends to store the memories. We'll talk about the risk factors, but most importantly, we'll talk about how to minimize that risk. Dementia is like headache. It's a symptom. It's not a disease by itself. It's a group of symptoms, like you have headache from many causes. A headache from tumor, from migraine. Similarly, dementia is a group of symptoms that are caused by more than 100 diseases. It's an umbrella term. Of course, the vast majority, 60%, is caused by Alzheimer's. The next major category is called vascular, which is related to high blood pressure, stroke, high cholesterol, things like that. So remember, dementia is a group of symptoms, similar symptom, memory loss and so on, caused by a variety of diseases. Okay, Alzheimer's being the main one. The four major signs of dementia can be said as the ABCDs of dementia. A standing that the person with dementia is not able to perform the activities of daily living, forgets to, do simple tasks like putting on clothes, and in the later stages they even forget how to eat and stuff like that. So forgetting about activities of daily living. Number two, there are behavioral changes. They're kind of lost, they are moody, they are out of it, they are depressed. So there are mood changes. They're withdrawn socially, they don't want to interact. Cognitive decline, that means intelligently, unfortunately, they lose their ability to make decisions. Calculations are difficult, simple tasks are difficult. Trying to remember simple words, they forget, they're talking and you forget common words that you want to use to express yourself. All signs of a cognitive decline. And lastly, disorientation. They are lost in time and place. They're confused where they are. You tell them you're home, and I know I'm at work, and the other way around. So there's confusion. So those are the basic signs of dementia. Inability to do versus males. The risk in females shown in the red line, which unfortunately is significantly higher for a number of reasons. By the time you are about 12% of females versus 8% of males. By the time you're 90, 1/3 of females, 30% will have dementia versus 20% of males. And the reasons being in the earlier ages, women were mostly indoors, they didn't work and things like that. But the major factor is after menopause, they stop producing estrogen, which is a hormone that keeps the mind going. So that increases the risk. And now there's talk about supplementing hormones, but there are other risks associated with supplementing. So it's still questionable how effective that would be. How do we diagnose dementia? Previously, it was all based on neuropsychological testing. You went to a neurologist and they would do, memory tests and all those things. But they were not very accurate. More recently, a blood test has been approved in the last couple of years, which is very accurate. If it's positive, you're 90% likely you have dementia. If it's negative, 90% probability you'll not have dementia. So recently this test has been approved, but this is for the main kind, Alzheimer's, where the blood test can show you whether you're gonna have dementia. Other than that, this cavity is enlarged because there's no brain there. So this is of course in the late stage, and that used to be done to confirm it, but by that time usually it's too late. Early on, diagnosis now would depend on the blood test, which is for looking for the tau protein, which is high. Very basic structure, basic description of the brain. There are a number of cells in the brain, different types, forget about them. The only important cell to remember is the neuron. This is the brain of the brain, the most critical cell in the brain. We all have how many? 100 billion. 100 billion of those critical cells in the brain that do all the thinking, calculating, decision making. These are called the neurons. And the structure of a neuron is, it has these short arms, which are called dendrites, where it receives the information from the other neurons. It processes the information, and then the long structure, which is called the axon, it sends whatever it has decided to do through that long axon to the other neuron, to the muscles, to tell the body what to do. And so that is the most critical cell in the brain, the neuron, where all the processing occurs. and we have 100 billion each. The two neurons are connected by a structure called the synapse. The neuron is as good as useless if you don't have a synapse because it cannot pass the information. So as far as I'm concerned, the most important thing in your body is the synapse, which passes the information from one neuron to the next. Whatever it has decided, it passes on to the next to do whatever you want to do, whatever you're thinking, whatever muscle movement you want to do. The synapse is the most critical thing, where it is able to transmit information from one neuron to the next. In addition, lately it has been found that memories are stored in that area, in the synapse, and in fact, the main correlation of getting dementia, when you get dementia, is the loss of the number of synapses, as I'll show you later. So synapse is the thing you want to remember. That's the linchpin of the nervous system. So before we talk about how we lose memory, a little bit about how we store memory. There are many types of memories, but the important ones are the sensory memory. We remember the taste, we remember the smells, we remember the sights. Then there is what we call the short-term memory. That's like a memory pad, a notepad, which you don't want to remember in the long run. But Mina's telling me, go get these things from, Costco. So I make a brief list, and I go there, get them. Yes, ma'am. And after that, I forget about them. Yeah. So that is short-term memory. That's not critical. What we are concerned about is long-term memory. What we want to remember in the long run, and that is of two types. One is called procedural, anything to do with using muscles, like how to walk, how to talk, how to eat. That is procedural memory. And then there's the semantic memory. Semantic memory is related to all the facts we want to remember. Names, places, anything to do with facts. That is semantic memory. So we'll talk a little bit more about the long-term memory, factual or semantic memory, for everything that we see, whether it is living or non-living. The brain tags it with three things. My grandson, Ammar, I have tagged them with three things. What is it? Where did I see him? When did I see him? So everything we see, a glass, it's a glass. Where did I see it? A cabinet cat. When did I see it? On Wednesday, this and this. So everything we see is tagged with these three things, whether it is living or non-living, like my favorite car when I was younger, or my favorite cat nowadays. Everything is tagged with these three labels, and then the brain has a filing system. All those things, wherever I saw Amar, I kept in those filing system. Whenever I saw, wherever, whoever I saw, everything is tagged, catalog. And all those things are connected together. So this is semantic or factual memory. On the other hand, procedural memory deals with anything to do with muscles, any procedures that we do. Walking, talking, brushing, driving, anything to do physically is procedural memory. And how we develop that. Look at the toddler learning to walk. See, unstable, not sure, has to decide where to put the next step, has to concentrate on walking, is learning. But in a few weeks, when he's learned to walk, you'll not be able to catch him. They know exactly where to go without looking anywhere. They're very stable, running up the stairs. You know. So what has the child learned to do? Is this thing. So when we think about something to do, motor cortex decides to walk. It coordinates with an area of the brain, the visual cortex, which tells us where to put your next step. And thirdly, with the cerebellum, which tells you how to coordinate your steps. And so when you keep repeating that cycle, walking after a few practices, that circuit gets imprinted in the brain. It gets printed in the brain. What steps are necessary to do the walking. So when we have learned to walk, we can walk without even thinking about it. We may be on the phone. We don't have to do anything. But we are walking because the circuit is already there. The brain knows exactly what to do. And this happens for everything that we do, every procedural memory, whether it's walking or whether it is tying shoelaces or whether it is driving, whatever we do, there are circuits imprinted in the brain that tell the brain exactly what to do. We don't even have to think about it. It could be driving and listening to the music or talking to your friends. We're doing it automatically. So everything gets automated.
Like when we're going to work or something, we start the car in the morning, and automatically we stop at the stoplight. We don't even realize.
So if you do a Google search for dementia, you know how many articles there are? 767 million. It's a huge topic. But if you are able to squeeze all of them down, if you were able to read them, one important thing that comes out of it, the most critical thing, synapse. Synapse is the linchpin of the brain, is the most critical thing related to dementia. And what our problem is, how not to lose the number of synapses, how to increase them so that all the circuits stay effective and we remember the memories and we remember the procedures. Okay. When we are born, at birth to puberty, there's a tremendous exponential rise in the number of neurons because the child is learning to do everything, walking, talking, going to school, learning new things. So the number of neurons explodes to 100 billion. And the number of synapses goes even higher. It gets to be about 1 quadrillion, a number I cannot even fathom. Imagine 1 quadrillion connections in your brain between the 100 billion. And imagine Allah subhanahu wa ta'ala, how He made the brain. How all those connections are going to the right places. 1 quadrillion of them between 100 billion cells. Amazing.
It's just one.
Subhanallah. So we have this explosion of numbers of synapses, the connections, and the number of neurons. But by the time we get to be about middle age, what starts happening? We have learned all the things we are supposed to learn. We have careers. We have developed some good habits and unfortunately some bad habits. So think about it, what to do about it. And most of the work is routine. So do we need all that brain capacity? Do we need all that computing power? The thing is, the brain is only 2% of your body weight on average. This part is only 2% of your body weight. But on the other hand, it consumes 20% of the calories you take every day. Only 2% of the body weight, but taking 20%, 1/5 of the calories you take every day. But if the brain is not using all those connections and neurons because you've learned everything is automated, everything is being done as a routine, then why waste all that energy if it's not needed. So what starts happening is there's a dramatic decline in the number of synapses as shown in the red line. So we don't need all that computing power, all those connections. So there's a dramatic decline. And if we are not careful about our lifestyle, we stop learning new things. We stop making new connections. We stop eating healthy foods. Then this number keeps going down. And that eventually would lead to the dementia. So what we need to do is, this is what happens actually. The tremendous increase in the number of synapses by the middle age, it stabilizes, but then it starts going down, and if you are not careful, it keeps going down really bad, and you end up having a dementia. So what are the risk factors? There are certain risk factors which we cannot avoid. Undereducation and air pollution. Undereducation, God forbid you're born in a certain situation where you don't get enough education. There's a higher risk in those people. Air pollution also a risk. There are certain factors which need a physician's help, professional help, like disorders like depression, diabetes, hypertension, high cholesterol, and things like that. They all lead to the vascular kind of dementia. That's where you make sure that everything is under control. Your diabetes is under control, your blood pressure is under control, cholesterol is under control, and you want to avoid head injury that increases the risk. The two things like hearing loss and vision loss that significantly increase the risk. You need professional help, but I have highlighted that because those two, you can personally deal with them quite a bit. Vision, if there's any question about it, make sure it stays corrected. You wear appropriate glasses, but hearing loss, which is the one we tend to ignore the most. My wife keeps telling you, "Sunte nahi ho?" You better listen, because eventually it's going to catch up. And I'm forgetting my hearing aid too, because if you're not getting that input, the visual input or the hearing input, the brain is not getting that information. You think you're getting it, but half the time you're not listening to it. You're not getting it. So eventually the brain is not getting it, says, forget it, I'm doing fine. It starts losing the synapses and stuff like that. So make sure. Nowadays, getting a hearing aid is as simple as getting on a laptop and you can do your own hearing screening. And hearing aids are over the counter. You go and buy your own. You don't even have to go to an ENT. And they're much cheaper than they used to be. So there's no excuse not to get a hearing aid. And every year, check on it. Make sure that you have adjusted it to your appropriate levels. And the things where we can make a difference is adaptation in our lifestyle to decrease the risk of getting dementia. And those are the adjustments I want to talk about. Of course, we want to avoid smoking, and alhamdulillah, we don't have a problem with the second thing. We want to control obesity. We'll talk about diet, how certain kinds of diets are helpful to minimize the risk. Making sure we get adequate sleep, making sure that we connect. We're not isolated. Because if you're isolated, you're not getting the mental stimulation. You're going to lose it. And inadequate mental stimulation, there are challenging things. Dementia with hearing loss. It shows you that if you have a mild hearing loss, you double the risk. Moderate hearing loss, you triple the risk. Severe hearing loss, 5 times higher risk. So please, this is not an excuse not to get a hearing aid. Everybody make that list, because I had actually to stop one of the medication because I was concerned about the risk. I changed it. So how do we minimize the risk? Unfortunately, there is no magic drug. Recently, a couple of drugs were approved, but unfortunately, the benefit they provided was very, very minimal. They were associated with a fair amount of side effects, including bleeding in the brain, and the cost was prohibitive, even with Medicare and stuff. So, at least in my lifetime, I don't see a magic drug coming to cure dementia. So the bottom line is, we have to adjust the other factors to minimize the risk. So what I mentioned to you is that the loss of the synapses is the main risk factor. So what we need to do is how to preserve them. And I will introduce you to a new term, neuroplasticity. Previously, it was thought that the brain is static. Once you lose it, it's gone. But since about the 70s, it was found that even if it's damaged, with appropriate stimulation, you can make certain structures regrow. So the brain can be molded. So that's why the term neuroplasticity. You can change it. That's what we need to do is neuroplasticity. Mold the brain so that instead of the synapses going down like that, we need that numbers to keep going up instead, so that we minimize the risk of forgetfulness and all the things associated with dementia. So how to preserve them? Of course, take care of the basics, which is controlling properly, controlling all the disorders that are associated, diabetes, high blood pressure, things like that. But what can we do to propagate the numbers of synapses is the lifestyle adaptations mentioned here. We'll talk briefly about those. Sleep is critical. Diet, a Mediterranean diet is very helpful. Exercise, I cannot stress enough. I don't mean going and doing a marathon, but at least going around the block, whenever you can. Exercise is so good, not only for the brain, but for a number of other things. And keep challenging your brain. The recommendation is get ideally 6 to 8 hours of sleep. That will minimize the risk. But if you don't get enough, less than 6 hours, the hazard ratio, the risk goes almost 50% higher, 1.5 the hazard ratio. On the other hand, you sleep too much, that's not good either. Because if you're sleeping, you're not getting any stimuli during that time, the brain is going to rot. So 6 to 8 hours is ideal. Why is sleep so critical? Sleep is so critical for 2 reasons. When we are awake, daytime, the brain is constantly working. Even if you're sitting down, it's looking around, it's getting the information. You're hearing stuff, you're thinking, the brain is constantly working. It doesn't get a chance to rest. Like when you're running, after a while you get tired, your muscles start aching, you sit down. That gets a chance for the blood to clear out the waste products like lactic acid and so forth. And once you do that, your legs feel better, you start running again. Brain doesn't have that luxury. All the time you're awake, it's not getting rest. So what's happening? All those waste products are building up in the brain. And when they're building up in the brain, they are damaging. You need the sleep, because sleep is the time where the brain can rest and wash out those waste products. In fact, we all have channels in the brain called lymphatics, which open up at night where the brain is not actively working. It doesn't need all the energy, so the blood supply is cut down, but instead the lymphatic channels open up to clear away the waste products. If it doesn't clear away, if you don't get enough sleep at night, you get up the next morning, you're groggy, you're out of it, you're not sharp. Why? Because all the waste products are still in there. So make sure you get at least 6 to 8 hours. The other main function of sleep is memory consolidation. All the day we are getting all those inputs, memories. There's so much going on, the brain doesn't have a chance to catalog them, file them properly. So what it does, it stores them in a temporary filing place. At night, when it's not getting all those information, that's where it gets a chance to take those memories out and catalog them, file them away in the proper places. There's a temporary storage area, which if you're not getting sleep, it gets overloaded, so all your memories you're getting, they're not going to be stored properly. At night, when you get a chance, when you're not getting all those memories, then the brain takes those memories out and files them. And the best time is when you get the REM sleep, with the rapid eye movement sleep, and that's where it is doing that thing. And when it is doing that thing, filing all those memories, sometimes those files hit some previous connections. That's why during that sleep, you also get dreams. And dreams about maybe something you had seen that day. That's because the memories from the day are being filed in that area, which you had stored before, those memories. So during dream sleep, the deep sleep, the REM sleep, that's where the memories are filed. And if you're not going to get enough sleep, they're not going to be filed properly, and you're not going to recover them later. So it files them at night. The two main functions of sleep: clearing waste products and filing the memories properly. How can we enhance sleep? Sleep hygiene, there's lots of articles on sleep hygiene and you can review them. But the most critical three things are: make sure you go to sleep at a fixed time. We all have a circadian rhythm, a clock in the brain determined by the sunlight, and that tells us when it's time to sleep and not to sleep. It releases the melatonin, which causes us to sleep. So you want to make sure you sleep at a fixed time and keep that time so that the clocks get set up so that you get to sleep properly at that time. Second important thing is make sure that the room is absolutely dark. Not even the light of that, charger, that LED light. Absolutely dark, because any light turns down the production of melatonin, which is a sleep hormone. So you want to make sure there's no light, and you want to avoid any screens for about an hour before sleeping, because that light is turning down the production of that melatonin. So fixed time, absolutely dark, and the third important thing is to keep the room a little on the cooler side. Comfortable, but not on the warm side, a little on the cooler side. You'll sleep better. And the sleep hygiene guidelines actually talk a lot of other things, but those are critical. Fixed time, darkness, and cooler side. Nowadays, you can get those watches, deep sleep, the REM sleep. That's where the memories are being stored.
Does the melatonin tablets or capsules, does it work?
What we produce naturally, we cannot, in the diet and the capsules, unfortunately, it's not the same thing. The best diet is the diet I love, a Mediterranean kind of diet. So what you want to have is lots of fruits and green vegetables. So green vegetables, fruits, Really good. Number 2, seafood, particularly salmon. Salmon twice a week. Very good for the brain. Number 3, nuts, particularly walnuts and almonds. Those are really good for the brain. And a moderate amount of cheese. And unfortunately, no biryani, not too much meat for starters. Yes, we love biryani, but you want to get more green vegetables, fruits, nuts, salmon.
What about
and
rice? Rice are good. Just rice, white rice.
No particular benefit, unfortunately. Just starch.
Starch, but they say it's a good source of energy.
Lentils are good sort of some protein and energy, but for the brain,
Oh, for the brain.
lentil. And we want to minimize red meat. So biryani में make sure
Salmon biryani.
That's our
salmon. मैं तो नहीं भाई से कहता रहता हूँ समोसे में भी salmon डालेंगे. And avoid anything that comes in a box that is pre-prepared, processed food. That's not good.
Is the shellfish any good?
जी
ये प्यालियों में क्या था छोटी वाली प्यालियों में ये दोनों चीजें
वो
वो
ते olive oil है.
और वो चीज थी.
Olive oil.
ये
वो
दोनों
चीज.
ये छोटी प्यालियों में
अच्छा.
Olive oil.
Olive oil है.
Avocado, cheese, and olive oil.
nuts है nuts है
Nuts है वो seeds है. Why is Mediterranean diet good? Mainly because it has antioxidant properties. And you hear a lot about antioxidants. What are they?
what do you mean by Mediterranean diet what is that Mediterranean
One
diet
with the fish.
The things are listed
Very-
before.
अभी थोड़ी देर पहले से कहना salmon.
Why is this helpful? You know, you hear a lot about inflammation. Inflammation comes from the word flame. Aag se inflame, inflammation. Where's the aag? Every tissue we have oxygen coming in, burning fats and glucose to produce energy for whatever we need to. That's a kind of energy, a kind of flame that is running there. But if it is severe inflammation, like you get a choke, ekdam laal ho jata hai, that's a body reacting to it. But if it's a chronic low-grade inflammation simmering, that is the inflammation we worry about because that is damaging our vascular system, our heart, our liver, our kidneys, in diabetes, our blood vessels. So that's what we want to suppress. How we can do that? So instead of the oxygen or oxidants, we want to eat antioxidants, something to stop that burning. So we want to eat foods that have antioxidants that suppress the oxidants, the oxygen and all that stuff, which in excess is causing inflammation and damaging the tissues. So foods that are in the Mediterranean diet are rich in antioxidants. That's the kind of foods that we want to eat. Sugars, fats, they are high in oxidants, they are bad. They are toxic, okay? So you want to have an antioxidant properties, which is Mediterranean diet. What is the other benefit? It promotes the development of the healthy kind of bacteria in the gut. Remember, you'll hear a lot more about the gut-brain axis. The kind of bacteria in the gut influences a lot of our brain function. Previously, it was thought, bacteria is a waste. No. In fact, the main nerve from the brain to the gut is called the brain. All the bacteria telling us, the brain, what to do, what not. So, what we eat is not only what we are, but also what our brains are. You'll hear a lot about the gut-brain axis, how what we eat, what kind of bacteria we have in the gut, how it manipulates or modifies our brain functions. And in fact, I will do a talk on the gut-brain axis sometime. So this Mediterranean diet promotes the healthy kind of gut bacteria, which is good for the brain. And number three, it reduces the intake of unhealthy fats and sugars, which tend to cause more inflammation. So that's the benefit of having that Mediterranean kind of diet.